Jai Hind and a very good morning to our respected Principal Sir, Dr. Nikhil Srivastav Sir, our Head of the Department, Dr. Vinita Nikhil Ma'am, esteemed Head of the Department's senior faculty members, our guest speaker, Dr. Richa Agarwal Ma'am, postgraduate students, our dear undergraduate students, and everyone joining us today. We at the Department of Conservative Dentistry and Endodontics, Subharti Dental College and Hospital, have organized an alumni lecture today for our students, to our students, and by our students. The intent with this alumni guest lecture series is to acknowledge the contribution of our exemplary ex-students who continue to make us proud even today and have held the name of the institution high. One such outstanding alumni of ours is Dr. Richa Agarwal ma'am. She will be enlightening us today on the topic changing trends in dental caries with more emphasis on the management aspect. At the onset, I would now like to request our Principal, Subharti Dental College and Hospital, Dr. Nikhil Srivastav sir, to kindly say a few words.
Jai Hind everyone, and welcome to this SALS. We call it as a SALS, the Subharti Alumni Lecture Series. This is the next edition, that is 2023 edition of lecture series. Friends, as you all know, that the Subharti Dental College was started in 1996, and almost many batches have already passed out, and then our alumni have been doing exceedingly well. So just to engage our alumni to the day-to-day activities of dental college and to encourage our students and those who are already studying here to see how our own students and now the alumni of Subharti Dental College have been doing a lot of good work, and then they are excelling in their own field. So for these things, to keep all these things in mind, then we decided again to start this Subharti Alumni Lecture Series for the Dental College. And today is going to be the first lecture organized by the Department of Conservative Dentistry and Endodontics. And Richa will be enlightening all the attendees, the delegates regarding the topic. And I hope this lecture series will be a great success. And all those who are attending and listening to our own alumni will be greatly benefited with this. So with these few words, I again welcome Dr. Richa and congratulate the Department of Conservative Dentistry, Dr. Vinita Nikhil, head of the department, and the entire team for hosting this very first lecture series of 2023. Thank you very much. Please carry on.
Thank you, sir. With your kind words and blessings, we shall now begin with the lecture. Before ma'am starts with her lecture, let me quickly introduce her to our audience. Dr. Richa Agarwal ma'am is a true blue Subhartian as she has completed both her undergraduation and post-graduation from Subharti Dental College. She completed her BDS in the year 2011 while securing gold medals in the Department of Oral Surgery, Orthodontics, and Oral Medicine. She was also a gold medalist university topper in her MDS. Goes on to say that she was a student par excellence. Today, she runs her own independent practice in Azadpur, Delhi. She has special interest in cariology, the topic which is today. She had proclivity towards finding extra canals in her MDS days, and as life comes a full circle, she now receives referrals for the same. Besides work, ma'am likes to travel, meet new people, sing, and also listen to music. It is indeed a pleasure to have you with us today, ma'am. Without much ado, I would like to now request you to begin with the lecture and enlighten our dear students. Ma'am. मैम आप का म्यूट है म्यूट से हटा दीजिए
Am I audible now?
Yes.
Okay. Now am I audible, Dr. Sonal?
Yes. Yes.
Okay. A very good morning to all of you. I feel elated to have this opportunity to present this lecture to the audience at my alma mater. And I feel really happy to get connected to you all once again. And as a very proud Subhartian, I wish you all a very happy Navratri. With the blessings of Goddess Durga, let us begin. So, this is a topic very close to me. Uh, Changing trends in caries management with more changing trends in dental caries with more focus on the on the management part. So, dental caries is the most prevalent oral disease globally and imposes serious health and economic burdens. I can't hear anything.
Yes, ma'am, you're audible.
Okay. So, dental caries is the most prevalent oral disease globally and imposes serious health and economic burden. As Bennett said, you never change your life until you step out of your comfort zone. Change begins at the end of your comfort zone. And similarly, a Spanish proverb said, a wise man changes his mind, a fool never will. So, I will discuss the management of dental caries under the various codes of ICDAS, that is, International Caries Detection and Assessment System. Starting with caries management, then. So previously, the approach was extension for prevention, which was given by Dr. Greenblatt. He focused on drilling and filling. But now, the approach is completely opposite, that is prevention of extension, which was given by Dr. Marshall Webb. Before deciding the treatment options, one should assess the caries risk of the individual. This is the flow chart focusing on the treatment options according to the caries risk. Now, as you can see in the low risk patient, we just have to follow clinical intervention plus home care, and then the recall is there after 1 year. And as the risk of the patient increases, the clinical intervention changes, which we will discuss, and the recall period it decreases. It, yeah. So, firstly, discussing the ICDAS code system. The full form is International Caries Detection and Assessment System. DMFT and several other indices have failed to meet the demands of the 21st century in achieving the concept of minimally invasive dentistry because of the inability to detect early enamel carious lesions. So the advantage of ICDAS is it can detect incipient carious lesions, starting with code 0. Code 0 means sound tooth surface. Code 1 is the first visual change in enamel, which is visible only after prolonged drying. Code 2 is distinct visual change in enamel, which is visible both when the tooth is wet as well as when it is dried. Code 3 is localized enamel breakdown. Code 1 and 2 Code 1 and 2, they didn't have enamel breakdown, but code 3 has enamel breakdown, but it has no visible dentine. Code 4 is underlying dentine shadow without or with enamel breakdown. Then code 5 is distinct cavity with visible dentine. And code 6 is extensive cavity with visible dentine. Now, can anyone guess this beautiful smile? Anyone? This is Dr. Manushi Chillar, Miss India, Miss World 2017. So, in order to get a perfect smile like hers, we have to follow code 0, that is prevention of dental caries. Okay, so prevention of dental caries it has conventional methods and advanced methods. So conventionally, first we should take care of our general health. If our entire body will be healthy, our oral health will be automatically good. And similarly, if our oral health will be good, our teeth will be caries free. Now, some conventional methods were oral hygiene aids, diet modification, fluorides, spit and fissure sealants, preventive resin restorations, and some advanced methods are these, which we are going to discuss in detail. Now, discussing some bits about the conventional methods, the oral hygiene aids are divided into toothbrushes. Now, these are various techniques of toothbrushing, amongst which circular method is most commonly followed technique. The other oral hygiene aids are interdental cleaning aids, dentifrices, that means the toothpastes, the disclosing agents, professional tooth cleaning, chemical agents for plaque control, which includes various mouthwashes. Now, there are advancements in all of these days. Now, diet counseling. As you can see, this is a dental food pyramid, which includes cariogenic foods, cariostatic foods, and anti-cavity foods also. There should be a perfect balance between these foods, that is the cariogenic and anti-cavity or cariostatic foods. As you all know that prevention is better than cure. In the diet counseling or diet modification also come sugar substitutes, which are non-nutritive and nutritive. Now commercially, most common commercially available sugar substitute is now xylitol in the form of gums and candies. Fluorides. Fluorides has been a very important part of dentistry. The fluorides, they lead to the formation of fluorapatite instead of hydroxyapatite, and which has a lower critical pH that makes enamel surface more resistant to dental caries. It causes mineralization of hypomineralized areas, therefore it causes remineralization of incipient lesions. It also reduces the adhesion of bacterial cells. It also modifies the tooth morphology. So these were the various mechanisms of actions of fluorides. Now fluorides are of two types, systemic or topical. Topical can be professionally applied and self-applied. So not going into details of the conventional systems. The pit and fissure sealants. What are pits and fissures? They are enamel crevices which are formed when the lobes of teeth fail to coalesce completely during amelogenesis. So the obliteration of these pits and fissures can prevent the occlusal caries, and because these pits and fissures are highly susceptible to the development of caries because of their anatomy. These are the various types of pits and fissures, that is V type, U type, I type, and IK type. The pit and fissure sealants now, they are classified into various methods according to their polymerization methods, the resin systems, filled and unfilled. They may be clear or tinted, and they are now recent pit and fissure sealants. Amongst the various recent pit and fissure sealants, we have fluoride releasing sealants, we have hydrophilic sealants, then we have self-etching sealants. For example, we have casein phosphate releasing sealant also. Now, this enamel lock is an example of recent pit and fissure sealant. This is the first self-etching light cured sealant. It releases fluoride also, and it can be applied in a single step. It has a low viscosity. Another example of recent pit and fissure sealant is Embrace. Now, these pit and fissure sealants, they can be used in ICDAS codes 0, 1, 2, and 3. All these 4 codes involve the use of pit and fissure sealants. Now, another slide showing you the examples of latest pit and fissure sealants. For example, Conceal F, Helioseal F, Delton. Then some GIC-based sealants are also there. So, moving on to preventive resin restorations. Now, this is an extension of pit and fissure sealants only. So, if caries are present in one area or a part of pit and fissure, those caries are restored and the adjacent pit and fissures are sealed. So, it leads to preventive resin restorations. It is of 3 types on the basis of extent and depth of the carious lesion. Type A In this, the carious lesion extends only into the enamel. It does not reach the dentine also. So it requires a very small round burr for the preparation. Type B, in this, the carious lesion extends to the entire enamel and it reaches a small part of dentine. So it requires a slightly larger burr for the preparation. Then type C, a preventive resin restoration. It involves entire enamel and a good part of dentine also. So new advances in preventive resin restoration, it is similar to the advances in pit and fissure sealants only, because there are a lot of advances in the pit and fissure sealants. Now starting the advanced methods. Now in the advanced methods, the first is lasers. The lasers, they provide enamel surface resistance to caries. Several laser wavelengths have been proposed. Sub-ablative carbon dioxide and erbium lasers, they increase the acid resistance of permanent young healthy teeth. Also, they alter the chemical composition of the crystals. And the lasers are antibacterial. So, another method is caries vaccine. The caries vaccine, they prevent the colonization of Streptococcus mutans in the oral cavity. And they work on the basis of the immunoglobulins, because in saliva we have IgA, immunoglobulin A, and IgG, it is present more in gingival sulcus. So if there are more antibodies in the gingival fluid, so it will correspond with the low levels of caries. Previously, there were mainly two routes of caries vaccine, that is oral route and systemic route. But now several other routes of caries vaccine have been proposed. For example, intranasal route, then tonsillar route, intragastric route, as well as rectal route has also been tried. And the latest development in caries vaccine is the nanoparticle based delivery of caries vaccine. Now coming on to probiotics. What are probiotics? Probiotics are certain live harmless bacteria which would occupy a space in the biofilm that otherwise would be pollinized by a pathogen or a disease-causing microorganism. So various mechanisms by which probiotics work are these. Basically, they are anti-pathogen. They don't allow the pathogen to multiply to cause a disease, and they are helpful, they are beneficial for the host. The naturally occurring rich probiotic food are milk, yogurt, cheese, and certain probiotic tablets and rinses are also available, and certain toothpastes also. And recently, sourdough bread, which is very commonly, which is popular amongst the new generation, it is also probiotic. Yeah, these are the various oral probiotic capsules or tablets, or in the form of lozenges, basically. Uh, This Pro-Dental, Oral Complete, and Oral Biotic, the lower three images, as well as the third image in the upper column, these are all Indian oral probiotic lozenges which are available commercially. They mainly contain the strains of Lactobacillus and certain probiotic strains of Streptococcus. So, before moving on further, we should know what are prebiotics. Now, as we said, probiotics are live microorganisms. But prebiotics are certain substances which are against the pathogens. So example of such prebiotic is arginine. So it has been seen that our oral cavity has various arginolytic bacteria which break down arginine to ammonia. Now, as ammonia, it neutralizes the plaque acids, and therefore their anti-cariogenous atmosphere is created in the mouth. As you can see in this image, this shows the black bacterial biofilm in the plaque, and lower image shows bacteria after arginine, and right side you can see bacteria before arginine. Also, this is a list of various food items which are rich in arginine. And other than food items, we also have certain toothpastes. For example, Colgate Total. It utilizes dual zinc and arginine technology, the latest Colgate Total toothpaste. Also, we have certain candies which are like very delicious candies which contain arginine. So basic bites, they are available in the name by the name of basic bites, but not in India. They are not available in India. Now, certain genetically modified organisms in foods have been utilized to reduce the adhesion and the biofilm of the plaque. Now, as you can see in the image in the background, that before the introduction of genetically modified organism, the plaque is too much, and after the modified bacteria, the plaque has significantly been reduced. And certain other attempts are also being made to create other strains of Streptococcus mutans, which are responsible for the production of lactic acid, as well as certain other strains of Streptococcus mutans, which cause that which destroy the Streptococcus mutans, which is the disease-causing Streptococcus mutans. Now let's move on to code 1. That is, now caries has occurred. Incipient carious lesion is there on the enamel. So as you know, that and remineralization and balance is being maintained between these two processes. So the remineralization can occur, and the lesion can be arrested and reversed before actual cavitation. But remineralization occurs at a pH higher than 6.5. Also, remineralization requires partially demineralized crystals. So, various agents which promote remineralization are casein phosphopeptides, amorphous calcium phosphate, combination of the two, which is most commonly available commercially in the form by the name of recaldent, that is tooth mousse or tooth mousse plus, the nanocomplexes of these two, beta tricalcium phosphate, and various other examples. And lastly, we have herbal compounds also which promote remineralization. For example, manuka honey, rosemary, ginger extracts, and grape seed extracts also. These are very experimental compounds. Certain studies have already been done on them. Now, let's move on to ozone, another advanced method. Now, ozone is given in the form of gas, ozonated water, or ozonated oil also. So a gas, the ozone gas is delivered through a cord and a cap into the carious cavity under a high pressure for 10 to 30 seconds by in the concentration of 10 to 100 microgram per ml. Now the basis of ozone is it is a powerful oxidizing agent. It is also toxic to the bacterial cell. It is antibacterial. It also removes the smear layer. So this is the apparatus to generate the ozone gas by the Cavo company. Now, these are certain examples of ozonated water mouthwashes. Towards your left, you can see Iozone Blue, which is an example of ozonated oil mouthwash. Another example of ozonated oil mouthwash is Iozone Rosa. Now, these two mouthwashes are introduced in Italy, and certain researches are already being going on for their use in the prevention of dental caries. Now, nanodentistry, as you all know, that it has entered into various aspects of almost all the aspects of dentistry, and similarly, they have been utilized in caries prevention also. The nanoparticles are of size 1 to 100 nanometers. The drugs can be encapsulated, dissolved, or trapped, or attached to the structure of nanoparticles. For example, calcium fluoride nanoparticles, chitosan, pectin, alginate nanoparticles. Nanoparticles with adequate amount of fluorides can be applied in the oral cavity. Now, certain metallic nanoparticles like silver, zinc, and titanium have also been utilized as they are highly antibacterial, and also they improve the mechanical properties of the dental materials which are used. Now, how will we manage 4-2 lesions? Now, distinct visual change in enamel. Previously, the concept was only drilling and then filling, but now the drill has been replaced. As you know, that ozone and lasers I've already discussed. Now, one new method is resin infiltration. So the process of resin infiltration works on the principle to perfuse porous enamel with the resin by capillary action. As you all know, that refractive index of resin and enamel is same, therefore it masks the opaque white appearance. For example, in the cases of dental fluorosis, this has been highly used. It stops the progression of the lesion and creates barrier against the further keriogenic attacks. It can be easily used in the patients with the age less than 18 years. For example, icon resin. The process is very simple. Now applying the etchant of 15% hydrochloric acid is used in this case. It increases the enamel porosity, and then infiltration is done by highly viscous and penetrating resin. Now code 3, where the enamel has already broken down. Again, previously the concept was drilling and filling. Now the drills have been now replaced. So we can use micro-invasive dentistry here. We can use pit and fissure sealants, preventive resin restorations, then atraumatic restorative technique, and we can also form tunnels and mini box and slots. Now I will discuss the micro-invasive dentistry, atraumatic restorative technique, and tunnels and mini box here. Okay, so can you all guess this beautiful tunnel in Delhi? Anyone? Okay, so this beautiful tunnel is basically, I think, from India Gate to Pragati Maidan, which bypasses a lot of traffic. So similarly, the tunnel preparation in dentistry, it bypasses the marginal ridge. It preserves the marginal ridge. So the tunnel preparation is of 3 types: internal, partial, and total. In this image, the third image is the example, is the tunnel preparation. Also here you can see in vitro model showing the tunnel preparation from the occlusal surface to the proximal surface. Also, this is the image of the tunnel from the proximal surface. Now this image shows the tunnel preparation in a molar and a premolar, adjacent teeth, adjacent to each other. Okay, so now as you all know that Diwali is round the corner, and in India we have a tradition of gifting boxes of love and prosperity to each other in the form of gifts. So correlating those boxes with the mini box preparation. So the mini box preparation in this, that marginal ridge which was preserved in the tunnel preparation is removed. But some other pits and fissures which are adjacent to the caries are not involved if it is not necessary. So what are slots? They are used for restoring proximal lesions on the posterior teeth. They are of 2 types, facial and lingual. Now this image shows the slots. This is a horizontal slot, the second image, and the third image is a vertical slot. Now all these preparations, they avoid the removal of extra tooth tissue. That is, remove only whichever is required. Now lasers have been used in various steps of dentistry, the various the branches of dentistry. Similarly, lasers have also been utilized to cut or for cavity preparation, to cut the dental tissue. So erbium laser is highly absorbed by water and hydroxyapatite in the dental tissues. What the laser energy does is it vaporizes the water in the tissue and also causes expansion and micro expulsion. And so it causes melting of hydroxyapatite crystals. So therefore it cuts the dental tooth tissue. Now there are various differences in the laser assisted cavity preparation and conventional cavity preparation. The lasers utilize their tips and they work in the up and down motion, whereas the conventional burrs, they utilize their sides as well as ends, and they work with the side brushing action also. Now the lasers, they eliminate the smear layer which was produced by the conventional burrs in the cavity preparation. Now another advanced method is air abrasion or kinematic tooth preparation. It utilizes the aluminum oxide particles. These are abrasive particles which strike the tooth with high velocity with the pressure of 40 and 160 size. The particle size of aluminum oxide particles is 27 to 50 micrometers. So this is the apparatus Prep Start, which utilizes this technology. Now, quickly moving on to another method, that is atraumatic restorative technique. This technique was given by Dr. Franken, and it was most popularly followed in Africa, Thailand, and China. It has got two components. It seals the caries prone pits and fissures, and also it restores the cavitated lesions with restorations with absolutely no rotary instruments, only hand instruments. Now this is the kit which is used for atraumatic restorative restorations technique. You can see only mostly hand instruments are there. Now, there has been a proposal to utilize this atraumatic restorative technique in the COVID-19 crisis which had occurred, because it produces absolutely no aerosol. So, in future, also in any such crisis, which God forbid should not be there, this technique can be utilized. Also, at our dental college, Subharti Dental College, we have a mobile dental van. Yes, this mobile dental van goes to various interiors and villages, and there sometimes a traumatic restorative technique is also followed according to the need. Now, code 4 is underlying dentine shadow with or without enamel breakdown. That is, the caries has now extended to the dentine. Now, these code 4 and code 5. Code 5 is when the distinct carious lesion is there in the dentine and the dentine is visible. They both require to be filled basically with the restorations. Earlier, the aims of carious tissue removal was to remove all bacteria and then the placement of restoration. But now, the approach is to not to remove all bacteria and then seal bacteria under restoration. So there have been great advances in the restorative materials, and they cannot be covered in such a small duration. So we'll discuss some things. For example, the principles of carious tissue removal. The principles are to avoid discomfort and pain, to achieve adequate seal, to preserve non-demineralized and remineralizable structure, to maintain pulp health, and to maximize the longevity of the restoration. So, the main advances in the caries removal is selective caries removal. Now, earlier some dyes were used, but now the dyes are rarely used because they are more time consuming and have a low specificity. So, now we are moving on to chemomechanical agents. Now, you all must be wondering why I have used the image of this good papaya tree in my background. As you know, this papaya tree, other than giving us delicious fruit, it also gives us a very useful enzyme, that is papain enzyme, which is the basis of so many chemomechanical agents or gels these days. So earlier, only Caridex and Carisol were most commonly used, the gels for chemomechanical removal. But now, as we have extracted this papain enzyme and used this papain enzyme is the basis of this Papa Cari and Cari Care. This Cari Care is Indian manufactured only. So these are the various gels for chemomechanical removal of caries. The process is this is the carious tissue. You leave the chemomechanical agent, that is any gel, over the carious tissue, leave it for the specified duration of time, and we remove the softened caries with the help of hand instruments. And in the final image, you can see the nicely removed image of the carious tissue, and the tooth is completely clean. Now, another gel which utilizes the papain enzyme is Brix 3000. Now, there are certain burrs also, smart burrs, which are called as smart burrs because they are made up of medical grade glass bead reinforced polymer. Now, the smart burrs, they cut only infected dentine. They don't cut healthy dentine. Now, this is the image of the smart burrs. Now, moving on to code 6, that is the last code. So, we have to manage the extensive carious lesion which might or might not have exposed pulp. So, it is done with the help of indirect pulp capping or direct pulp capping, which are combined known as the vital pulp therapy methods. Now, we have to take care that we follow these principles while vital pulp therapy. First is diagnosis. We should be able to select a case which is perfectly suited for pulp capping. Isolation is must for pulp capping. If it is not properly isolated, pulp capping won't be successful. Then we should know that we have to create caries free zone. No amount of bleeding should be there. Pulp capping agent, the choice of pulp capping agent is important, and it's also important to maintain the seal for the longevity of the process. Yes, the ultimate objective is to preserve the vitality of the pulp. Earlier, only calcium hydroxide was used as the material for the pulp capping, but now various other methods like calcium silicate based materials, for example, MTA, biodentine, and other methods like lasers, growth factors, dentine silophosphoproteins, bone morphogenic proteins, some enzymes also like heme oxygenase 1, endogain, propolis, and stem cells have also been utilized for pulp capping. Okay, so to conclude, this was just the gist of the advancements in the management of dental caries. Similarly, there have been advancements in the diagnosis. We have come far away from bulky hand instruments to treat dental diseases to a simple gel, for example. And this is just the beginning. Okay. In the end, thank you. I would like to thank Goddess Durga to bless me with everything, to thank respected Vinita ma'am, who has always mentored me and guided me throughout and also pushed me to try new and different always. To all my teachers, my seniors, my batchmates, my juniors, and my family who have always supported me and have enabled me to give this presentation. Lastly, I would like to thank Dr. Sonal Sahu, without whose help this presentation would have been incomplete. And I would like to wish a very happy Diwali to you all in advance. Thank you.
Thank you, ma'am. Thank you so much for this wonderful lecture. It was so informative, and I'm sure that our students had much to take away from this. Ma'am, we do see a few questions in the comment section. So, with your permission, we'd like to take them. First question is, ma'am, can you please tell names of toothpastes which can cause tooth
Pardon,
remineralization?
I'm unable to hear.
Ma'am, I
Yeah.
repeat, the question is that can you tell the names of some toothpaste that can cause tooth remineralization?
Oh, yeah. Yeah, we have several toothpastes which cause tooth remineralization. For example, Enapic, Toothmin. These two toothpastes have calcium sucrose phosphate technology, which utilizes Sensodyne Repair and Protect is also there. Then Zero Sense ka repair wala toothpaste is also there.
Okay. Thank you, ma'am.
Then Elsen's is also another toothpaste.
Okay, ma'am. The next question is, ma'am, why did you choose ICDAS 1 and not 2 for this
Okay.
presentation?
So, other than ICDS 1, there are ICDS 2 and several other indices which are not used, and we have particularly chosen ICDS 1 because it is very simple and also it can detect the early enamel caries. But ICDS 2, it is very complicated. It requires two digits to be used. It also takes into account caries related to restorations, to sealants, and it also some it has to take into account root caries also. So it is also very time consuming. So the ICDS one is very simple, is short, easy, and it also detects the early enamel lesions.
Okay. Thank you so much, ma'am. With that, we conclude the lecture and the comment section, answering the queries in the comment section. Now, I request our respected head of the department, Dr. Vinita Nikki, ma'am, to kindly say a few words for our guest speaker, Dr. Richa Agarwal, ma'am.
Jai Hind all. A very good morning and Jai Hind, Richa. Thank you so much. You know that how proud we people are of you, and you have really proved it. First of all, you accepted our invitation, and then the topic we told that we want you to speak on it, and you made this topic so simple for your juniors, the budding Subhardians. So thank you for everything, Richa. Sir already told what was the objective behind these alumni lecture. In addition to what he told, I want to tell you that we want to create a bond between the alumni of Subhardi and the budding Subhardians. They should know what their seniors are doing, how much heights they have achieved, and how they can work hard and to achieve that heights. So keep inspiring them. Be adhere to your alma mater, and on occasion of your alumni lecture, I just want to present a certificate of appreciation to you. Thank you once again. God bless you.
Thank you, ma'am. Thanks a lot.
Thank you everyone for joining in. With that, we conclude the alumni guest lecture from the Department of Conservative Dentistry and Endodontics, Bharati Dental College and Hospital. Thank you all for joining.